Medical professionals of Reddit. When was someone's self-diagnoses surprisingly accurate? Story 1. Once while I was working as an EMT, we ran a call for a guy who had gotten shit-faced and fell flat on his face on the sidewalk outside his apartment. Cutting open his forehead at the hospital, he was told he would be breathalyzed to obtain a BAC and loudly proclaimed him feline. 308, he promptly blew a 308 and the whole ER team applauded. Story 2. Disclaimer: I worked part-time in triage at the ER, so I'm not sure if you'd call me a professional. That being said, I don't remember a single person who claimed they had a kidney stone who was wrong. Story 3. My son came home from Iraq with a weird skin lesion that the army doctors diagnosed as psoriasis. I didn't buy it. I did some research online and suspected it was leishmaniasis, an infection transmitted via sand fleas. I took him to a private dermatologist and presented my research. The dermatologist sent a biopsy to the CDC and got the official diagnosis. The army still insisted on labeling it a nonspecific skin irritation. They didn't want to pay for the expensive drug regime. I hired a lawyer. The army gave in and paid for the treatment. Sure, it cost us about the same to push them into it as if we'd just paid out of pocket, but it was worth it to force them to put the proper diagnosis into my son's records. Story 4. I had a dude come in the ER the other night and tell us he thinks he was shot. He absolutely nailed that one, but in all seriousness it was GSW to the head and the MRI was gnarly. Everyone with the MRI questioned most bullets are composed of non-ferromagnetic material, but yes, it is a case-by-case call. Careful consideration of risk-benefit is therefore recommended in all patients. There is an MRI screening done by an on-site rad. If one isn't available, the screening goes to a telerad facility to okay the go-ahead. This is all post-CT. Story 5. Just the other week, had a 60-year-old guy, reeking of cigarettes, come in for upper endoscopy camera to look at the esophagus, stomach and part of the small bowel. He was describing food getting stuck mid-swallow in the middle of his chest. I think it's esophagus cancer, he said. I was thinking that too, but didn't say anything. Sure enough, that's exactly what it was. Story 6. Hidradenitis suppurativa, recurrent severe skin abscesses. She came in saying that she was worried she had it because she's had some abscesses in her armpit. 9 times out of 10 it's because of shaving with a dirty razor, which is what I told her. I'll be damned if she was right. Ended up having 5 abscesses that formed tracts requiring surgery. They recurred a few months later. Sent to dermatology who confirmed the diagnosis. Story 7. I correctly self-diagnosed a blood clot in my leg. I went to the ER with excruciating pain in my calf and told the doctor that I suspected a blood clot. The doctor assured me that I was young and healthy and I wasn't at risk for a blood clot. He diagnosed it as a pulled muscle, offered me some painkillers and sent me home. Fast forward 2 or 3 weeks, I still had excruciating pain in my calf, and I started to develop severe shortness of breath. I went to the urgent care clinic this time. The doctor at the urgent care clinic immediately suspected a blood clot and sent me to the ER for some tests. The ER doctor did an ultrasound on my leg, declared that I didn't have a blood clot, and sent me home. The next morning, someone from the ER called me and sheepishly admitted that they had misread the test the night before, and I did in fact have a blood clot. It turned out that I had had a blood clot in my leg all along, and the clot had broken off and traveled to my lungs. Thankfully, I've made a full recovery, despite nearly being killed by the incompetence of multiple doctors. Story 8. Saw someone ER. She had a runny nose and was insistent that her cerebrospinal fluid, the fluid that surrounds your brain, was leaking through her nose and causing her to have a runny nose. This is usually pretty unlikely, especially without a history of trauma. Order a CT of her head, but doesn't show anything and she otherwise looks fine, so she's sent home. She comes back the next day with a jar of this fluid she had collected saying this isn't snot. Ran some more tests and turned out she was right. I'm glad she was persistent. Story 9. I watched the episode of Grey's Anatomy where there was a patient with severe migraines and Derek Shepherd can't figure out where his pain is coming from. Mark Sloan comes in, looks at him and shoves a pencil up his nose, diagnosing him with a deviated septum. For years I had suffered with migraines and headaches and recently stopped breathing fully out of one side of my nose, stuck my finger up, felt bone, went to the doctor a few days later. My general doctor didn't believe me. I went to an ENT and told him what I thought was wrong, and by golly I was right. Severely deviated septum, had surgery a few weeks later. Edit: do not stick your fingers up your nose if they are not clean. Also don't stick any foreign objects up there because gross, unsanitary, haha. Story 10. Worked in the ER when a lady ran in screaming that her husband was dead in the car. Staff walked out to see. I asked if they should hurry and they said no because people exaggerate those things. Turns out dude was dead, based on the smell and bloating, had been for 3 or 4 days. She was a junkie and was living in the car for days before she noticed he had odd. Story 11. I went to my doctor because I thought I had appendicitis. He agreed and sent me to the hospital. They ran tests, said I was fine and should go home. I refused, called my doctor, who called them and made them rerun the tests with someone who knew what they were doing. They came back to me and had me in surgery within 2 hours. Story 12. When trauma patients say, "Am I going to die?" right before they lapse into unconsciousness or get tubed for surgery, they're usually right, and they know it. Story 13. Edit: I included more stories. I gotta make this post quick. PEDS resident here. Now let me state for the record that parents are extremely likely to overcall everything. 99 out of 100 self-diagnoses are probably wrong, but that doesn't mean I won't listen to their specific concerns. In fact, as I try to teach my interns, actively listening and directly addressing their concerns is often the only way to convince them that their son's cold is not, in fact, cancer. A couple catches. Warning: these are sad. 1. Mom and grandmother bring their 2-month-old into the ED. She's been spiking fevers and not drinking well. ED works her up for viral process. Call me. I'm working in the general pediatric unit because mom is refusing to go home. Find a mom who is obviously pretty low SES, poor and uneducated. I don't say this to slam the mom. I say this because there's a good chance she got ignored because of those facts. I listen. Kids not acting right, far less interactive. Not feeding well, unexplained fevers, grandma and mom know something is wrong but can't express what. I listen, then examine the child, borderline hyperreflexive, really crappy though the kid's old enough that it might explain this. I touch the anterior fontanelle, the soft spot on the top of infants' heads, bulging. Head CT shows a pretty massive bleed outside of the brain. Already asked mom when the changes in the behavior. Monday, where is baby? Sunday, at boyfriend's house. Boyfriend later admits to dropping a television on the infant's head because she was crying too loudly. Good ending, kid shown essentially complete neuro recovery. Followed her a few months out. You wouldn't know she had suffered a head injury. Am cautiously optimistic. Just got a Christmas card from the mom. Nice family too. Similar story. PA calls because she isn't sure what's going on with this 12-year-old boy in the ED. Also a bounce back for dizziness. They did a decent cardiac workup. I ask about the neuro exam. PA says the kid is alert, oriented, and no focal neurological deficits. Okay, he'll come down and see the family. Most dizziness is without discernible organic cause and self-remitting. Really don't want to admit a healthy kid into the hospital. Ask parents what's up. Mom is concerned that he has a brain tumor. This is not an uncommon concern. Turns out there's a family history of tumors. Examine the kid, including a thorough neuro exam. It's grossly abnormal. Kid has visual field deficits, part of his vision is black and it's gotten blurry. He has lower extremity hyperreflexia. When I tap the tendons in his leg with the reflex hammer, it jumps really hard with clonus. When I check his reflexes or suddenly move his foot, it spasms, and the muscles in his leg twitch. He has an upgoing left side Babinski. When I scrape his foot with a sharp object, his toes fan out rather than fold down, which indicates possible brain spine damage. He has gait disturbance, he couldn't walk. He kept falling to one side. He has dysdiadokinesia. When I ask him to do rapid, repeated hand movements, his hands shake, and he can only do them slowly while concentrating hard. MRI brain. He's got a tumor called diffuse intrinsic pontine glioma DIPG. He died less than a year later. Mom was right, I have more, some with happier endings, but I gotta run to clinic. Edit. Given the responses, I wanted to update on some of the common responses to the first two stories. Story 1, yes, the boyfriend is in jail. CPS had already been involved, as had our child abuse specialists. Every once in a while I can good cop my way into getting an abuser to confess. He did. I contacted the detective. Yes, child abuse of all kinds sucks. It's the worst part of my job, but it's also a very important part of what I do. I'm in a position to help protect children when nobody, including the people that should protect them, are. At least I can say I make a difference. But it does you up. I do see a counselor. I do have stress. I do struggle to cope. I translated the neuro exam into English, sorry. Story 2, agreed. Cancer. Most advances in childhood cancer have turned diagnoses that carried fatal prognosis into highly survivable. Medicine is incredible, and I am so hopeful for a day that DIPG gets added to the list. Some cancers are highly heritable. Some are random, we say sporadic. DIPG is actually sporadic. There are no genes IRC that are associated with DIPG, which is good news, at least for family concerned that their other children might acquire it. The PA was really torn up about missing the neuro findings. She was extremely busy and her very brief neuro exam was not thorough. I actually took her to bedside and showed her the findings so she could learn. I feel like teaching and improving is the best way to correct for mistakes in our clinical practice. She is normally very thorough and will never forget the importance of a good neuro exam now. Since I got a few replies, hey race, a couple more stories. 3-year-old kid comes in with possibly having aspirated a bead. Mom describes a coughing fit normal, and then he's normal, but now he's completely normal, except for a very occasional cough. Now, in all likelihood, the kid has coughed it out or will cough it out, and the residual cough is just from a little irritation of the lining of the air tubes bronchi that the bead tumbled through. The thing is, the kid was insisting that he felt the ouch in his chest. We get an XR. It looks completely normal except for a tiny linear patch of atelectasis, tiny bit of collapsed lung. This can be normal with a little mucus. It also was on the wrong side for most foreign bodies. The tube leading to our right lung is slightly steeper than the tube leading to our left lung. So most objects will tumble down the right, the path of least resistance. This patch was hidden behind the shadow of his heart on the left. EM attending was convinced he was okay at that point. He left it up to me. I called ENT, they didn't want to touch it. I called pulmonology. The pulmonologist on call is this salty 70-year-old Jewish guy. I love this man who basically flatly says, Dr. Brabafet, yes or no, am I going to bronch this kid? Bronchoscopy. A small camera attached to a thin, flexible tube which is passed down the airway into the lungs. He's leaving it up to me. I say yes, knowing that if I'm wrong, he'll probably get a solid chewing. Turns out I was right, bead wedged in one of the small segmental bronchi of the left lower lobe. This guy was a pretty awesome proceduralist too, and was able to get a large enough flexible bronch down that he could attach a grasper to it and pull it out. Normally rigid bronch is necessary to remove foreign bodies. So yeah, 3-year-old called that one for one case he'll never forget. I teach medical students and junior residents with this case. I was working in my very favorite place to work, the PICU Pediatric Intensive Care Unit, and I get called down to see this 14-day-old kid. Mom had taken the kid to the ER something like 4 times. You'll never forget how hard she fought to figure out what was going on with her kid. It probably helped her that it wasn't her first kid, and so she knew that something was off. Basically, the kid had a little nasal congestion, some faster than usual breathing, and wasn't feeding well. Each time the mom brought him in he looked worse. I'm on the phone with the EM resident who is a little more attentive than previous residents and is just concerned. His sixth sense is buzzing. Something doesn't seem right and he's hoping I can see the kid ASAP. I ask what kind of workup they already ran, what sort of studies have been done. Just some normal lab work, which was reassuring. No elevated white count to suggest serious infection. Viral studies from previous visits have been negative for common viruses, e.g., RSV, flu, adenovirus, etc., and chest X-ray CXR was read as normal. I pull up the CXR and see this. In case you are concerned, no HIPAA breach here. I removed all point identifiers to publish this case in the literature already. For reference, this is what a normal neonatal chest XR looks like. I tried to draw a blue dotted border roughly around the heart. The red lines approximate the distance from the left side to the right side of the heart border. Needless to say that heart was big. The fact that it was read as normal floors me. I tell them to page cardiology and echo and meet them down there. The kid was close to respiratory failure by the time we got there. I feel his arm, strong pulse, feel his thigh, no pulse. Turns out he had something called coarctation of the aorta, and the little fetal ductus arteriosus was the only thing keeping the blood going to his lower extremities. The duct was closing as it naturally does. We started him on a drug to keep the duct open, intubated him, and got him to the operating room that evening. He did quite well. Lesson to medical professionals: always check your own labs and images. Trust but verify. When I was 11 I fell ill and couldn't eat, move, etc. So my parents to me to the doctors were told I had the flu and to keep me hydrated, etc. I didn't improve, and eventually they went to the hospital, and knowing my parents either screamed at someone as a Glaswegian accent or threatened physical violence to get someone to look seriously at me. Turns out I had meningitis. Apparently it was a 95% mortality rate in infants at the time, and the infection had gone so far that I barely responded to treatment. My parents were told that it was probably my last night and that they could take me home to spend time with me. Apparently I survived and have no lasting effects, aside from a couple small scars on the back of my hand and on my ankle from the drips, and I have awful balance. It's crazy to think that I survived, let alone almost unscathed. People lose limbs and have massive life-changing things happen to them, and I'm sat here shitposting on the Reddits. Cheers ma, edit, because this got a lot of traction. Half of these comments are just reinforcing my belief in how lucky I am, and making me really sad. I'm sorry for people having to go through this, amputations, deafness, etc. if you even manage to survive. Thanks for sharing. Yes, I'm aware that there's probably hyperbole from my parents. Unfortunately, I don't have my own account to tell. They were turned away from the doctors because there was no rash at the time, which was meant to be a big indicator. Apparently I did have one, but it came and went super quickly, so no doctor got to see it. I ended up having spinal fluid taken and a lot of tests being done when they diagnosed it. I can't remember which type of meningitis it was. I really haven't dug into it very much. It affects my life so little, I've never had a reason to. If anyone's got knowledge of the subject, I'm happy to learn. You'll have to sit and talk to my mother when she visits for Christmas to find out more. It was 92-93, in Greenock, which is just west of Glasgow, Scotland. Supposedly I'm still alive. Doot doot. Story 14. Not me, but Ugimla Thobo wrote once about one case had a patient come into the ER complaining of unbearable pain and was yelling aloud any time she was touched. Several of the staff were saying before I went in, "Oh great, another drug seeker is here, Well, I took her history and performed an exam. She said, I think I have cancer. It has to be bone cancer or something wrong with my bones. Mind you, she said she hadn't completed high school and did not mention looking anything up on an internet anyhow. I so much as placed a hand on her or she moved an inkling, the patient would scream out in pain. Turns out she had some lytic bone lesions and was a textbook case of multiple myeloma, white blood cell cancer in the bones that leads to horrible bone pain and pathologic fractures. Yes, she didn't technically have bone cancer but rather plasma cell cancer. From that day on, I never treat a patient coming in with pain as a patient just malingering, but really try to get to the bottom of the source and cause of the pain. Furthermore, people presenting to the healthcare system who practitioners may label as drug seekers often do have some sort of pain. Yes, psychological pain is still pain, yet has a different treatment than handing out opiates. Unfortunately, the treatment those patients need is seen as not my job, or I don't have time for that, as I have heard it put as the patients get kicked to the curb or handed a script to get them out of the office or ER. Sadly, the U.S. health system in my area has been failing patients afflicted by mental health IMO. Story 15. Not a medical professional, but I got hand, foot, and mouth disease back in my senior year of high school. I knew it was that because we were working with a virus that causes it in my biotech class. Doctor told me that there was no way I had it, because only children get it, and it rarely occurs in the winter. So he ordered a couple expensive tests, and sure enough I had it, by far the most miserable 2 weeks of my life. Story 16. I'm not medic, but one of my coworkers is. His best story: once a woman came to hospital to prove herself diagnosed diabetic. Blood test proved it. Doctor asked how did she know it. She answered that her urine is too sticky. And it makes sense, high sugar level can affect urine too. Story 17. My stepfather is a doctor and told me 2 stories. One was an older Irish woman who correctly predicted that she had a tumor in her left lung roughly the size of a golf ball. She has never smoked or done anything that made her a risk, but she insisted her very mild cough was the result of a large tumor and demanded to have it checked out. She was dead on and claimed she saw a person on TV with the same symptoms, and when she fell asleep her dead husband in her dream told her to go to the doctor, and her she was. The second was a guy who said he felt like he was stabbed and thought something went wrong with his surgery when they removed a cyst from his lung. He was half right. The surgery went fine, but he had a thin strip of metal shish kebabbing him through the chest because he apparently plopped onto his bed without removing some junk including a large 6-inch receipt spike. His bandages covered up the new wound. In other words, it felt like he was stabbed because he was stabbed. Bonus: an old lady told a room full of very alarmed doctors, who thought she was ridden with very dense, possibly calcified tumors, that they didn't need to worry. Also, those are probably from the time a crazy guy shot her with a shotgun when she was 15, but it's okay now because she forgives him as it's God's job to judge, you know. They had 2 of the pellets removed as one was sitting on her heart and another was pressing into a blood vein but easy to get to, and left the other 25 in. Weirdest thing my stepfather says is that she made it to 80 years old without ever getting an x-ray of anything but her foot, so there wasn't a single word of it mentioned anywhere. Story 18. Oh man, finally a spot to post this story. I'm a Navy corpsman, so I've heard my fair share of interesting stories and self-diagnoses from Marines. This one is probably the only one that has ever truly caught me completely off guard though. A young lady comes in and asks me in a low voice if she could talk to me in private before she made her appointment. Usually, that meant one of 2 things: an STD check or some sort of feminine concern, genitourinary symptoms, wanting contraception, pregnancy. So I took her to a quiet, semi-isolated area and asked her what's wrong. I have worms coming out of my anus, and I think I got it from my cat. My initial response was, okay. What makes you think that? She describes the worms and why she thought that. For the record, her symptoms were an itching in the anus, worse at night, and she had felt little wriggly things when defecating. Her cat had been diagnosed with worms and slept with them in the bed, and her husband was also showing symptoms. I take the history as best I can, go to my provider, explain it to her. She's just as confused as I am but says, well, if she says it's worms, let's get a fecal sample, and lo, she returned 2 days later with a fecal sample that tested positive. I have a couple other stories I'm happy to share, but this one was the most off-the-wall one. Edit: my top comment now is about worms. Thank you Reddit, never change. Story 19. Not a doctor but a patient. Had pancreatitis a few years ago around 2014. Always had stomach problems, but no idea why until that day. 2 years later in 2016 I had the same terrible pain. Tried to wait it out for 5 or so days, but broke down and went to the ER. I said I think I have pancreatitis. Was treated like a drug-seeking alcoholic, and I stopped drinking in 2014 because of the pancreatitis. Doctor tried to tell me it was indigestion. When I asked why I was in constant pain even when I haven't eaten in 3 days was when the doctor completely changed her attitude and pretty much told me we're not going to help you. About 3 months later my lipase levels were high enough to be considered an attack, so I was admitted and was diagnosed with chronic pancreatitis, not alcohol-related. I still think about that doctor, and it makes me so angry. I wonder if my life could have been a little better if they took me seriously and found it out sooner. 2017 has been rough. Story 20. I diagnosed myself with an adrenal tumor. My primary care doc kept telling me my symptoms were caused by lifestyle choices. I went to my GYN who took me seriously when I showed him my research. It was a cancerous bioactive adrenal tumor the size of a grapefruit. That was over 2 years ago and I'm still fighting this cancer. I developed either recurrence or mets a few months after my initial surgery, and I've been dealing with liver and lung mets ever since. I won the argument with my primary care doc, but my prize was cancer. Sad trombone. Story 21. When I worked as a camp counselor, I woke up one morning with severe joint pain. I slept on the ground the night before, so I chalked it up to that. When it didn't go away after a couple days, I went to the camp nurse who diagnosed me with dehydration. After downing a 12-pack of Powerade, I'm still surprised I didn't pee blue. I still had the joint pain. A bunch of the other counselors were convinced that it was stress or that the fluid in my joints had dried up. Then I went and did the one thing you should never do. I logged onto WebMD and searched my symptoms. And right after cancer was Lyme disease. It made a lot of sense, but I never had any rash or noticed any tick on me. So I went back to the camp nurse and she had me leave camp to get a blood test, and I ended up going into the ER because there wasn't a clinic available. The nurse gave me a shot for the pain, drew my blood, and an antibiotic on an empty stomach just in case. Turns out I was allergic to the antibiotic, so I got hives and I threw it up. I received a call the next day that yes, I did have Lyme disease, dried up joints. My story 22. I caught whooping cough, Bordetella pertussis, and literally begged the doctors to run tests. Weeks and weeks passed, and they just told me it wasn't whooping cough, but I was catching back-to-back flu colds, bronchitis. Girlfriend also caught it, and we again begged them to run tests, to which they told us they don't want to, because by now they can't treat us anyways, so it made no difference. I explained that as they told me it was just a cold. I'd been going to work for weeks. While sick I hate this too, But I wanted to keep my job, so I went, and 2 colleagues have newborns, so it would be good to warn them in case they catch it off me. They ran the tests and diagnosed us. But such a pain in the... Story 23. My wife's OB/GYN was out of the country when she started to go into labor. Her blood pressure had been high, but we were monitoring it. In the hospital it was through the roof. I looked at her chart, researched everything online, and told the doctor on call that she has HELLP. He ignored me, said it was fine. When the delivery was almost done, her blood pressure dropped to nothing. A nurse shot her up with something because the doctor was busy eating lunch, and she recovered, but I will never forget holding my wife's hand thinking that this might be the last time I see her alive. When her OB/GYN got back to town, she confirmed the diagnosis I gave independently. We live in a small town. That doctor avoids me. Story 24. I'm a nurse, but these are me as the patient stories. When I was in high school, I started feeling very rundown. It started with a cold, then a bad sore throat. I started sleeping a lot more and didn't eat as much at that time. I was a walking garbage disposal. My dad took me to urgent care. They did the typical strep test, which was negative. My dad asked if it could be mono. The doctor laughed it off, said it was an upper respiratory virus. Take some Tylenol for pain and I can continue my normal routine. Week later, we're back at urgent care as my condition only got worse. I lost 10 pounds and was ridiculously pale for mid-August. My dad demanded a mono test. And guess what? That's what I had. The doctor then changed his tune to I need a lot of sleep and fluids. You to her main. Next, my first year as a nurse, I started feeling off. I would forget mid-sentence what I was talking about and entire conversations. I started getting too tired. I was sleeping 16 hours and that didn't feel like enough. I was always freezing cold aside from the normal Ohio April. And at random intervals, my arms would either get numb or get pins and needle feelings. Got myself a primary care physician, went to my appointment. I told the woman I'm pretty sure I'm anemic. She argued, ordered a pregnancy test, negative, tried prescribing me antidepressants saying that was the issue. I got pissed and demanded blood work to be done. My lab work comes back, another round of mono, and anemia. The doctor who called to tell me my results apologized profusely and we had a good laugh about maybe that's why I'm so tired. TLDR, Lake Health, edit. Wow, I'm sorry to everyone else who had to go through this. It's terrible how doctors are so quickly to write people off, even though there's something obviously wrong. Mono or anemia, you can feel there's something chemically wrong in your body. The depression or pregnancy part of my ordeal with that doctor completely pissed me off. And the more annoying part is the pregnancy test was a urine test. She wasn't even planning on a blood test until I demanded it. Patient comes in and says I've cut my finger off. The patient had indeed cut his finger off. Story 25. I'm a medical student now, but back after I took them cat I developed a rash on my left flank that was painful. I'd been incredibly stressed and my history was significant for chickenpox, so I self-diagnosed shingles despite being in the wrong demographic, and it turned out to be correct. Figured it out early enough to be treated before I suffered possibly permanent nerve damage. Also, there are a few episodes of mystery diagnosis where people figured out what was wrong as lay people when their physicians were stumped. Story 26. I'm actually the patient and self-diagnosed a fractured foot. I looked up on the internet how to test if a part of my foot was fractured, and you put your finger on the bottom of your foot on the outside and pull up. If you feel pain in blank area, it's likely a fracture. So I go to the emergency room and get in and tell the doctor I think it's a fracture of the 4th metatarsal. He looks at me kinda strange and says, well, let's do the x-ray before we speculate. He came back after like an HR and says, well, you were right, we are getting you fitted for crutches and a boot right now. I felt like a legend after that, since usually the internet just tells me my cold is cancer. Story 27. I work in primary care, primarily with CV risk reduction, uncontrolled diabetes, blood pressure, lipids. I often hear I just like to eat, and I'd rather take an extra pill instead of eating less. Nailed it. 1010 for insight, 110 for motivation. Story 28. Patient not doc, but I was almost as amazed as my PCP when I was right, so we'll share. My dad had been diagnosed with a fib and an arrhythmia a year prior. He was told that most people are not diagnosed until they have a problem. My dad took me and my kids to the science center where they had an exhibit all about the human body. There is a section all about the heart. They had several things that would monitor your heart rate, including a drum that would beat along with your heart when you touch sensors. Everyone else had nice steady heartbeats show up on all of the little things that they had, but mine kept acting funny, and so did my dad's. The thing was I didn't have any symptoms and I felt perfectly normal, so I didn't think that it would actually mean anything. It's basically a toy, right? I told myself I'd feel dumb if I didn't mention it to my doctor in case there was a link. When I suggested that I thought I had arrhythmia because the science center gadget didn't pick up my heart rate the same as everybody else, my doctor looked at me a little funny, but ran the tests. Sure enough, they found it and did a few more tests to establish a baseline for comparison later on in life. Story 29. Not nearly as dramatic, but apparently scabies literal on Earth is hard to diagnose. I noticed the symptoms pretty quickly and thought my childhood eczema had come back to haunt me, when treatment for that only seemed to make it worse. I figured out that it had to be scabies, all the normal problem areas, itchy at night, etc. The problem was, I couldn't get the lotion to treat it without a doctor signing off. I went to the doctor and she immediately starts diagnosing me with everything besides scabies while I'm telling her multiple times that it's most definitely scabies. I went 3 to 4 times, and the last time I left when she refused to allow me to get the treatment cream and wanted to say I had allergies instead. I told her I was not putting up with this torture while she keeps taking my money and misdiagnosing me, and she goes, well, I'm sorry, You aren't getting scabies treatment without a doctor's note, and I really don't think you have scabies. Apparently she never heard of Amazon. I went home, ordered permethrin SP, 10 off Amazon. 5 is what's used for treatment, mixed it with a thick lotion and cleared right up. I was so tempted to call her and let her know, but she probably would have said one of her earlier attempts at treatment finally worked. Story 30. Not a medical professional, but I knew I was diabetic before anyone else because I'd read the Great Brain books, including the one where a kid died from it, and they'd mentioned his symptoms, which I had. Luckily, the book had also mentioned that diabetes was now treatable, or I would have been one very upset 7-year-old. I mean, I was anyway once my mom explained what this diagnosis meant for my future candy consumption, but at least I knew I wasn't about to die. Story 31. Had a guy come into the ER. He handed me a paper on brucellosis, saying that he had an infection with brucella. Turns out he was a large animal vet professor at a university, and was working in a lab studying the disease. He was right. Story 32. After hurting my knee and having to ice it all the time, I found I kept breaking out in hives after the ice. I went to the doctor and told him I thought I had cold-induced urticaria, allergic to cold. My parents scoffed at it. The doctor had never had a patient with this, so it was dismissed. After it kept happening to me, I got them to send me to an allergist. My parents thought I was crazy until the doctor confirmed my diagnosis and handed my parents information on anaphylaxis. But at least now I get a handicapped parking pass in the winter and don't have to shovel the walk. I live in Canada. Story 33. I once went to the hospital on public transportation and told the person in the ER that I have a headache and think that I'm about to have a seizure. They wanted me to sit down and wait in line for a doctor, so I did sit down and had my seizure maybe 10 minutes later. When I regained consciousness, there was a doctor, so apparently I could skip the line. Story 34. Obligatory. Not a medical professional, but I have a funny story about self-diagnosis from when I was in a motorcycle accident. It was a head-on collision, and I had go over the hood and windshield of the car that hit me and skidded through an intersection, was wearing a helmet, boots, leather jacket. I absolutely had a massive concussion but wasn't aware of it at the time. I was not in pain. I felt disoriented and insanely thirsty, but no pain. I sat up and took off my helmet, and there was a crowd of bystanders trying to get me to lay down, but I just wanted to go home. The thing is, no matter how many times I tried, I could not actually stand. When the EMTs arrived, I was sitting upright on the ground, and I helpfully informed them that I thought my leg might be broken, because I had tried to stand and found it was not weight-bearing. One of the EMTs scoffed and said something like, "You think or no?" I very sincerely insisted my leg might be broken, at which point he got serious and asked me if I had actually looked at my leg or not. I hadn't thought to do that. Bear in mind I had one of a concussion. I looked down and there was my bone sticking out from my skin and through the denim of my jeans. There was blood everywhere. "Oh," I said. "Yes, your leg is definitely broken," said the EMT gently. "Well," I said reasonably, "I mean, how do we know yet? I mean, we should probably get an X-ray. Shock is a hell of a drug."